I have no conflicts of interest to disclose. Currently, there are no standardized guidelines that exist for endoscopic tattooing of colorectal lesions. And as such, there's wide variability in tattooing practices and lesion localization error rates, which may lead to tumor misidentification at time of surgery. Our objectives were to determine the rate of endoscopic tattoo placement at our local institution, determine the tattoo location in relation to the lesion, and determine what factors are associated with preoperative tattoo placement. We performed a retrospective chart review and conducted univariate and multivariate logistic regression analysis. Overall, we identified 1,385 patients who underwent elective colorectal resection for a polyp or cancer during our study time period. And after a number of exclusions, 1,062 patients met inclusion criteria. The mean age of our sample population was 68 years old, and just over half were males. At index endoscopy, just over half of the endoscopies were performed by surgeons. The majority of endoscopies were performed in an urban setting, and the majority of patients had lesions located in the right colon. At index endoscopy, our tattoo rate was 57%. With respect to the tattoo location in relation to the lesion, the majority were not documented, and just about a third had tattoos placed distal to the lesion. A few had tattoos placed both proximal and distal, and a select few had tattoos placed only proximal. With respect to our multivariate analysis, we found that lesions located in the transverse colon had endoscopies performed in an urban setting, had surgeries after 2010, and those who had planned laparoscopic surgeries were more likely to undergo preoperative tattoo placement. However, patients who had rectal lesions were less likely to have a tattoo placed at index endoscopy. In conclusion, tattoo method and location in relation to the lesion are variable and lack consistent documentation. Both lesion location and laparoscopic surgery are important predictors of preoperative tattoo placement. And interestingly, tattoo placement was higher in urban compared to rural areas. And it's interesting in that this provides a unique opportunity to focus on educational initiatives with respect to knowledge translation and streamlining care in rural community practices. But overall, there is a need to establish standardized tattooing practices and reporting amongst endoscopists, which is crucial in preoperative planning. Thank you very much.